the committee leaders that played a key role in introducing legislation, holding hearings, coming to a consensus, folks that need to be reckoned with. I'll start with the upper right-hand member first, Senator Max Baucus from Montana. He's chair of the Senate Committee on Finance. We think the healthcare reform bill in the Senate will come out of his committee sometime in the next couple of weeks. Senator Kennedy as well, healthcare or health concerns aside, sort of the godfather of healthcare, that worked on behalf of patients and providers for a long time. He'll play a key role. Senator Tom Harkin from Iowa was appointed by Senator Kennedy to lead the Prevention Task Force. Representative Waxman from California is chair of the House Committee on Energy and Commerce. Frank Pallone is the chair of the Subcommittee on Health, Energy and Commerce. He was my boss's former committee, Billy Tozan, John Daigle, Charlie Rangel from New York, Jeff Bingham in Vermont, Senator Mikulski, Maryland, and Jay Rockefeller of West Virginia. All these folks have played a key role in healthcare reform. Let's talk about health reform finally. Let's talk about the policies and what we think it's going to look like. Now, little history, as I mentioned. Current debate is focusing on addressing costs, not just expanding coverage. When I talk about 1993, about a clear agreement on what the problem was, 1993 was more about coverage, covering people who do not have access. Today, it's a little more concerned on cost. I think, how are we going to pay for this? There's however many millions of uninsured people in the country. How are we going to pay for this in our current economic environment? Now, because of the cost issue, employers and big business are prominent endorsers of reform, whereas in 1993 they were not. Don't know if you've seen, recently our industry, the providers, the hospitals, the insurers have come together with left of center groups to advocate for meaningful healthcare reform, which certainly this part right here says a lot about now in 1993. Transparency, as I mentioned, tremendously. President Obama has played this masterfully. He's invited lots of folks to the White House. He has regional forums inviting different ideas on what needs to be addressed. And then timing. In the technology age, the internet, with interest groups being able to rally their constituencies at the click of a button, folks are advocating more and more frequently, in greater numbers on healthcare reform than ever before. So now is the time. As I mentioned, the Senate does expect to introduce legislation in early June. That should come out of Chairman Baucus's committee. And we should have something in the House shortly thereafter. Now, both chambers determined to pass the bill by August. I've been in this town 15 years. We'll see what happens. It's going to be a very challenging time. As I mentioned, unlikely bedfellows coming together, which shows that the time is ripe for meaningful healthcare reform. Recently, my organization, PhRMA, along with the American Medical Association, the Cancer Society, Blue Cross Blue Shield, Families USA, and SEIU, which is the largest union representing service employees, came together, spent a lot of money on ads inside the Beltway, some outside of the Beltway. Don't know if you saw them, but they talked about the importance of meaningful healthcare reform. They talked about the economic recovery and how that was tied to it. So just to show you, give you some texture of folks from all walks of life, from all political interests, really think now is the time, and the president's doing the right thing. Next slide, Leroy. Now, this is just some more texture. On the 11th, the president met with the heads of these organizations, PhRMA, which is my organization, AdvaMed, which represents the medical device manufacturers, AMA, which is the American Medical Association of the doctors, AHIP, which is the providers, AHA, which is the hospitals, and SEIU, which is the unions. He brought them together and he got a commitment that none of us would expand our healthcare spending beyond a certain percentage over the next several years. Folks sent the president a letter after that reaffirming their support. As I mentioned, early June is when the rubber should meet the road. There's a block quote there is, we will do our part to achieve the administration's goal of decreasing 1.5 percentage points the annual healthcare spending growth rate, saving $2 trillion or more. $2 trillion is nothing to sneeze at, even in this town. Talk about some of the policy projections or policy ideas that Congress have. Senator Max Baucus, as I mentioned, chair of the Senate Finance Committee, released a white paper in November of 2008 talking about what he thinks healthcare reform should look like. Recently, Senator Baucus and Grassley co-authored a white paper as well. 3 key points from that I think will be addressed in the legislation: transform the delivery system by improving quality and reducing costs, expand healthcare coverage for all, and making the financing more efficient. As I meant, keep it simple, as I talked about before. Next. Some policy issues. Next slide, Laura. So one of the policy issues that healthcare reform needs to address is chronic disease. A lot of folks talk about the high cost of medical care. You've heard about it, you've read about it, you've seen it. Some people say, this costs money, drugs cost money. The largest cost driver in our healthcare system today is chronic disease and treating chronic disease. Diabetes, heart disease, cancer, you name it. That's what we're spending the most amount of money on. 75% of it stems from that. The economic stimulus package may include, or has included, $4 billion for prevention initiatives and $1.5 billion for community health centers. They're on the front lines of treating people with chronic disease. The Baucus white paper talks about it for an entire chapter. And the good thing is that both Republicans and Democrats alike agree that this is something that's got to be addressed. There's a group that I'll talk a little bit more about in my next slide, the Partnership to Fight Chronic Disease, that we're very involved in. It's played an integral role in bringing that topic to the forefront. Just talking about budgeting and finance and how we score that. But the CBO Office Director, Elmendorf, did express some skepticism about savings in a variety of approaches to rating and costs. This is a challenging issue. How do you legislate folks living more healthy lives? It's certainly going to be a challenge that'll face Congress. Next slide. Comparative effectiveness research is another hot topic. Not to get too down in the weeds from a policy standpoint here. Essentially what it does is it bases treatment and care upon past numbers and statistics, sort of takes the care out of the doctor's hands and bases it on research and analytical thinking. Obviously, some of that is good to contain costs. We do have some concerns about, if you go to your doctor with a specific ailment and he, rather than treat you as an individual and refers to past research to treat you, there's some danger there. Former Senator Daschle talked about this. An agency that's modeled in Britain's National Institute for Health and Clinical Excellence. There's been some talk about establishing some sort of agency in the United States that's similar to that. Expansion of the Agency for Healthcare Research and Quality, and then creating a public clearinghouse for private CDR studies. Those are all concerns. There is widespread bipartisan support. The CBO's estimation implementing this option would increase the federal deficit by $860 billion from 2010 to 2019. There's a disadvantage of accelerating research on comparative effectiveness. That negative results from early studies might discourage the use of promising treatment before it had been adequately tested. And that's certainly one of the concerns we have. The doctor-patient relationship and how they prescribe and how they treat their patients is certainly second to none. So we want to preserve that.